Hello, I'm Hisako, a midwife at Babu Babu Maternity Clinic. Today, I want to take some time to talk about very early miscarriages, specifically focusing on chemical pregnancies. So, miscarriages usually happen about a week after a missed period, and that's when people start to think, You think my period hasn't come, am I pregnant? Then you take a test, get a positive result, and go to the hospital. This is the usual pattern. The expected period coincides with the 4th week of pregnancy. From there, after a delay of about 1 to 2 weeks, most people go to the hospital around the 5th or 6th week. At that early stage, it's quite common that nothing is visible in the uterus yet. It's too early. The pregnancy test is positive, but we can't see anything in the uterus just yet. When something appears in the uterus, that's a sign of an intrauterine pregnancy. However, if nothing shows up in the uterus, but it is still positive, it might be an ectopic or extrauterine pregnancy. Ectopic pregnancy, an abnormal pregnancy that occurs in the fallopian tubes, abdominal cavity, or ovaries instead of the uterus, can also happen. In such cases, you may be asked to come back a week later for confirmation. Typically, a miscarriage happens around the 5th or 6th week. Around this time, a fetal sac can be seen in the uterus. Although it's ideal if the baby is visible, the situation is when the baby isn't visible even after 2 to 3 weeks. A uterine pregnancy is confirmed, but the fetus isn't visible. Or perhaps the fetus is visible, but you can't confirm their heartbeat. Or maybe the heartbeat is confirmed, but at the next checkup, the heartbeat disappears. Something like that. But usually miscarriages tend to happen typically between week 6 and 10 or at 11 weeks. Usually miscarriage happens around then. In this situation, the primary cause is usually chromosomal abnormalities. The issue lies mostly in the fertilized egg, not in anything the mother did, such as exercising too hard, taking medicines, eating certain foods, or going on vacation. There is no responsibility on the mother's side. It is mostly a miscarriage due to chromosomal issues with the fertilized egg, accounting for over 90%, maybe even 98%. Before that, there's also chemical pregnancy. Originally, when the sperm and egg meet and form a fertilized egg, this happens in the fallopian tube. Over about a week, the fertilized egg travels through the fallopian tube to the uterus and implants into the uterine wall, establishing pregnancy. However, this implantation is a challenging process. Even if a fertilized egg is formed, it's uncertain whether it will develop into a healthy embryo. Interestingly, only about 20% of fertilized eggs successfully implant. Around 80% of fertilized eggs do not develop and eventually disappear. As it undergoes cell division and gradually develops into a baby, it attempts to implant itself in the uterus. If chromosomal abnormalities prevent further development, the embryo fails to implant, leading to a miscarriage. However, this timing could fall around when the expected period would occur. Back in the day, we didn't have pregnancy tests like we do now. Back then, without pregnancy tests, people would go to the hospital after a late period or symptoms like a cold or morning sickness to confirm the pregnancy. So, when it comes to a chemical pregnancy, it occurs very early on. In the past, if your period was late and more painful or heavy, you just think, this period is different, and leave it at that. Even if a fertilized egg is formed, around 80% of the time it does not develop properly. Yes, all of this is a chemical pregnancy, but now with the improved accuracy of pregnancy tests, it's more detectable. And for those trying to conceive, they often experience pseudo-pregnancy once they enter the luteal phase. They might feel a bit off, like they're sleepy or queasy. If you time things right, you might think, maybe I'm pregnant. It's like some kind of instinct is at work, but that instinct is not reliable at all. I think it's possible to get caught up in a pseudo-pregnancy feeling. When that happens, even though the pregnancy test instructions suggest waiting about a week after your expected period to take the test, in fact, if you test around the expected date of your period, you'll get a clear positive result. Because people know this, they often end up testing too early. If you wait a week after your period is late to take a test, you might be past the chemical pregnancy stage. In many cases, the test is performed when menstruation is expected. During this time, even if the fertilized egg is not normal, there may be some embryos trying to implant. Even if it's meant to be a chemical pregnancy, the hormone HCG, which supports the continuation of the pregnancy, is already being released from the ovaries. The pregnancy test detects it, and then it clearly shows a positive result. But after seeing the positive result on the pregnancy test, the next day you start bleeding and have cramps, thinking, wait, this is just like a period? It starts with bleeding like usual. Then after it calms down, you take a pregnancy test again, and it's negative. It feels like a miscarriage, but it's actually a chemical pregnancy. With a more advanced miscarriage, ideally it would be a complete miscarriage, but sometimes it can be an incomplete miscarriage. And then there's a situation where the baby is still in the womb, but the heartbeat can no longer be detected, and the baby remains there, which is called a missed miscarriage. In situations like this, a procedure known as uterine evacuation is performed. Sometimes a simple medical procedure might be necessary, but in the case of a chemical pregnancy, the fertilized egg attempts to implant in the uterine lining but doesn't quite succeed. Therefore, it is very unlikely for any contents to remain in the uterus after such an event. It's expelled like a slightly late or more painful period, so medically, it's not classified as a miscarriage. Right now in Japan, and possibly in the United States as well, a chemical pregnancy is not classified as a typical miscarriage. They're considered to be the same as period, but maybe it's just a difference in values. In Western countries, chemical pregnancies are also considered a type of miscarriage. Honestly, I'm not sure which one is the right answer. The current view of the Japanese medical community is that a chemical pregnancy is considered to be a period that is slightly heavier and a little later than normal. Even though the pregnancy test was positive, a chemical pregnancy that ends in miscarriage is no longer considered a miscarriage. There's nothing to worry about, and you can continue with your daily life as usual. But after seeing the positive pregnancy test, you might think, I was pregnant, but then I had a miscarriage. When you're trying to conceive, this can feel especially disheartening. Is it a good thing or a bad thing? The accuracy of pregnancy tests has improved so much. In the past, many women experienced chemical pregnancies without even realizing it. In the past, not knowing was a kind of peace, but now due to pregnancy tests, people are more aware. Yes, that's something that happens. I have experienced chemical pregnancies multiple times myself. A miscarriage that takes place after the proper implantation of the embryo is referred to as a clinical pregnancy loss. In the current OBGYN field, it is said that this is completely different. After going through a chemical pregnancy, you might think about how long you should wait before trying to get pregnant again. In Japan, it's not classified as a miscarriage. So, after your next period, you can start trying again from the following ovulation cycle without any concerns. This won't cause any strain on your body or lead to an increased risk of miscarriage in your next pregnancy. Since your body is ovulating properly, it means you're ready for your next pregnancy. After what is commonly referred to as a miscarriage, some doctors suggest waiting 1 or 2 menstrual cycles before trying to conceive again due to hormonal changes. But with a chemical pregnancy, that's not something you need to worry about. Even though you know you were pregnant, just put that aside for now and think of it as your normal period. You can start trying again from the next ovulation without any issues. Experiencing a chemical pregnancy can be truly devastating for women trying to conceive. The fact that the fertilized egg was able to implant itself is already an incredible achievement, overcoming tremendous odds. Even if implantation occurs, only about 20% of those fertilized eggs are chromosomally normal and can survive past 10 or 11 weeks. In about 1 out of every 8 to 10 cases, after 10 weeks, chromosomal abnormalities cause a miscarriage. When you think about it, it's truly a miracle that a fertilized egg with no chromosomal issues can develop healthily in the womb until birth. Many women go through chemical pregnancies. It is devastating, but try not to let it get you down. I've been through it several times myself. It's best to stay positive and look forward to the next pregnancy. Even if you experienced it, it doesn't increase the risk for the next pregnancy. Above all, the best thing you can do is stay positive on your journey to pregnancy. I think it would be good if you could think about it that way. Currently pregnant with my 12th child, this is a midwife's guide to parenting. Please subscribe to the channel and join us.